I am Dr. Silpi Bardhan. I'm talking from South Kolkata. I basically have my own practice. I've been practicing since the last 10 years in the Bhawanipur region. So today I have been requested to give a small talk on lifestyle changes for Barrett's esophagus. So as we all know, Barrett's esophagus is a condition commonly seen in patients who suffer from long-time acid refluxes or a condition known as gastroesophageal reflux disease. In Barrett's esophagus, the appearance of the tissue of the inner walls of the food pipe, called the esophagus, changes due to the damages caused by long-term contact with stomach acid. Although there is no physical symptoms of Barrett's esophagus specifically, people affected by this condition can have symptoms of GERD, which will include indigestion, heartburn, difficulty in swallowing, coughing. Some people also experience chest pain, the feeling of vomiting, and also sometimes they also bring up acid from the stomach. So basically, the treatment for this kind of a condition is medical treatment, which mainly focuses on treating the acidity through the use of medicines to reduce the production of the stomach acid. So another option involves removing the damaged section of the esophagus through surgery. So one is the medical treatment and the other is the surgical treatment. So obviously we always go for the medical treatment and the lifestyle changes in the beginning. So besides these, there are various lifestyle changes that the persons who are affected by this condition can make to control the disease. So patients are basically asked to have some dietary changes, which might include irregular exercise also with dietary changes. Dietary changes include not having food items that increase or cause acidity in one's stomach and avoiding rich, spicy, and oily food, which we mostly Bengalis are prone to have. We like spicy, oily food. So this is one which we always request our patients to avoid. Other changes which we request them is that to avoid alcohol and smoking. Also, they have the sensation of chest pain, so hence we ask them to wear loose fitting clothes, which and also to reduce body weight. That is one of the main points in dietary changes to reduce body weights. Hence, we ask them to do regular exercises. There are various exercises which help the symptoms of GERD. So one of them is the shakers exercise, which can help improve their ability to swallow. These are exercises, you can get them on YouTube or anywhere, or from the references which are given in this link. You can find these exercises, how to do them. It consists of also two exercises which are performed lying down. The first exercise involves the person lying on their back. The person must lift their head and try to look forward towards their toes and hold the position for 1 minute at least. This exercise should be repeated 2 to 3 times in one go. The shorter version of this exercise involves lifting one head and then resting it down to 30 minutes. So if this type of exercise can be done back to back, then mostly the patient will have some relief. And also proper lifestyle changes can also reduce the chances of Barrett's esophagus, worsening the progression of cancer. So mostly this is a small talk on Barrett's esophagus, and the main what we see from the lifestyle changes is that the patient should try to just as a recap, dietary changes. So reduce oil in this food, spice in the food, also avoid alcohol and smoking, wear loose fitting clothes, and also the main one is to reduce body weight, because this Barrett's esophagus is mostly seen in obese patients. So the two exercises, the shaker exercises, can be done to improve their ability to swallow, and this will help them in taking more better care of their digestion and other digestive procedures which happen inside the patient. And also, proper lifestyle will always change to help reduce the chances of Barrett's esophagus, as I have been telling you for the short period. So, thank you mostly. This I'm going to leave now, as mostly the part which I wanted to tell you, inform you, I have completed. So thank you very much, and bye.